Good evening, Greyhounds. I am Dr. Benita Coleman, Superintendent of Ocean Springs School District. I hope this message finds all of you safe and healthy and eager to return to school in a few weeks. As you probably already know, our Board of Trustees elected to return to school on August 5th on a traditional schedule. I want to first thank all of you for your patience and understanding as we navigate this unprecedented time. I know everyone has plenty of questions, and rightfully so, on how this will work because so much of COVID-19 is still unknown. Hopefully, the resources we have released and are planning to release will help ease some of your concerns. We began preparing for a situation like this in early April. Our staff has been working day, night, and on the weekends on planning for a safe return, as well as implementing strategies to help mitigate the spread of COVID-19. We know plans are not always perfect, but we are prepared to adapt as we learn together. We have been consulting with our OSSD Medical Advisory Council to develop protocols for maintaining the health and safety of our students and our staff. We have carefully reviewed the results of the surveys that you completed to prioritize and also emphasize the specific modifications that are most important to you. 63% of our parents said in their survey that temperature screenings for students and staff members were of the highest priority for returning to school. We have trained our staff on recording temperatures and checking common fever symptoms. We have ordered thermometers for each school to screen students and staff members to check temperatures upon their arrival to each campus. 48% of our parents said CDC guidance training for OSSD employees was also an important factor for returning to school. All OSSD staff will receive professional development for reducing the likelihood of COVID-19 when they return to work on August the 3rd. 25% of our parents expressed they would only send their child back to school if social distancing, hand washing, face covering guidelines, and temperature checks were enforced. To address this, our staff members will be required to wear a mask at all times, and our students will be required to wear a mask while in hallways and on district transportation when social distancing is not possible. Our school schedules have been modified to assist with one-way traffic flow in our halls, and we have placed social distancing decals on the floors of all of our schools to assist with proper distancing protocols. Our school buses will be cleaned between each route, and students and faculty will receive temperature screenings upon arriving on campus. We have placed 600 hand sanitizer stations throughout our buildings, turned off communal water fountains, and will also limit the sharing of objects. Students will eat lunch in the classroom to avoid congested cafeterias. Recess times will be staggered, and cleaning protocols are being implemented for high-touch items in the classrooms, playgrounds, and in our schools. These are just a few of the many measures in place to help ensure a safer environment for our students and faculty. OSSD Greyhound Virtual Academy will be a completely different virtual experience than what took place this past spring. The virtual experience will consist of recorded, standards-driven lessons from each subject, live teacher Zoom meetings, scheduled virtual office hours, daily special area classes, and so much more. Students who have IEPs or receive special instructional support will continue to receive those supports virtually. There will be a schedule established for each student each day to ensure that all supports are being carried out. We would also like parents to know that our Board of Education has made the decision to remove the physician statement from the Greyhound Virtual Academy application. You may now apply using the high-risk/immunity portion of the application. In addition, we are reviewing applications as they are received, and we plan to begin notifying families on Friday, the 24th, of the application status. Now for a sit down with Dr. Logan from Singing River Pediatrics and also a member of our Ocean Springs School District Medical Council. Hello, Greyhound Nation. I'm Benita Coleman, Superintendent of Ocean Springs School District, and I am here with one of our OSSD Medical Council members, Dr. Andrea Logan, who is with the Singing River Hospital Pediatrics Clinic. Dr. Logan, thank you so much for being with us today.
Great to be here.
So we have a number of questions, Dr. Logan, that we would like to ask you. Some of these were actually taken from our social media sites that parents and teachers continue to ask, and so we thought it would be helpful if we came directly to a pediatrician. You have been phenomenal in terms of just helping us really craft our health and safety protocols and our restart plan, and so I'd like to jump right in.
All right, let's do it.
So the first question that a lot of our community members have had is,
Is it safe for our schools to open on August the 5th?
So, we are currently experiencing an unprecedented global pandemic in the world. So everything is very strange, right? And so there's not a way to be 100% safe ever. In fact, as a pediatrician, we deal with viral infections every year. Students catch illnesses at school every year. We don't want children to catch any illness, but it kind of is what it is. We don't have a whole lot of control over the fact that there's this new virus out there. What we are grateful for is that children do not seem to be as severely affected by the virus. So the way pediatricians generally are looking at it is if we're willing to take the risk of sending our children to school for RSV and the flu, we think that's reasonable to also take the same risk with the coronavirus that's out there right now.
Sure. I think in our restart plan, we talk as much as we can about minimizing risk. We cannot absolve the risk right now, but we can minimize it. So with that being said, what makes schools, especially with the protocols that we have developed, safer than a public place?
And again, reducing risk without eliminating risk is going to continue to be a theme, because there's no way that we can guarantee that nothing is ever going to happen. It can't be done.
Sure.
So for the schools, we do have a whole lot of measures that you guys have put in place to help reduce the risk of people spreading germs, and we know that we're observing those, and we know that those students are performing hand hygiene. We know that those students are going to be cohorted with their individuals, so we can contact trace and we can reduce the number of different students each student is in contact with. We know that we can encourage outdoor time playing, and I don't know what is being done in other situations. So, whereas if you go to the movie theater, Dr. Coleman and I aren't there watching what's going on in that movie theater or in that bowling alley. So we can do our very best to mitigate risk in our schools where we have a little bit of control over the situation.
Sure. One of the things that the Medical Council has been, I think you all have researched and studied, and we finally, and there was a recommendation made, was around students wearing masks. And that's one of the, I would say, the most frequent questions that we hear. Why aren't we requiring students to wear masks all day long, all 5.5 hours?
So pediatricians have kind of all agreed. I've been in contact with a lot of other pediatricians in the state as well, and the American Academy of Pediatrics and Mississippi Academy of Pediatrics. And basically, the bottom line is we look at risk and benefit in all situations in medicine. So whereas it is going to reduce the amount of COVID or other virus, particles that you may cough on your neighbor if you wear a mask all the time, wouldn't it be great if that was feasible? The risk is that it's not super practical for students to wear a mask the entire day without very frequently touching that mask. And when you touch that mask over and over again, you're getting all kinds of germs all over the mask, all over your hands, and then we're going to have not only just keeping those germs that when you're touching your mask, but also we're going to have skin infection, you're going to have impetigo, you're going to have fungal infections from students unable to really wear the mask properly without touching it over and over.
Sure. The other thing you spoke about already is that we are planning as part of our protocol to keep our students in cohorts so that we can better contact trace. Can you really, describe for our parents and our community members what contact tracing is and how keeping students in cohorts actually is a benefit to that?
Right, so even without the contact tracing part, right? So if I'm only exposed to the same certain students all the time, well, great, that's less students that I'm going to be potentially getting germs from than if we're just all exposed to everyone. So that in and of itself is one reason to cohort. But yes, also, if you have the students cohorted, they have their assigned seating. I know that I'm sitting next to Dr. Coleman every day, so should I, God forbid, come down with COVID and test positive, then we know Dr. Coleman was sitting next to me and she was in close contact with me, so contact tracing is how we're going to identify people who were close contacts with the student who was a positive, or the teacher or the administrator.
Sure. Can you talk for a bit about, because there's also, a lot of information about the virus, and the more we go through this whole pandemic, we find out more. Of course, all of this information is fluid, but can you just kind of talk about how the virus is transferred from person to person?
So mostly through respiratory droplets. So in other words, when I cough or sneeze and little bitty tiny particles of spit come out of my mouth into the air, those are carrying a lot of virus. We don't know, there may be a little bit of airborne just virus transmission, but predominantly it seems to be in those droplets. And so that's the major transmission.
So Dr. Logan, thank you so much for answering these questions today. And of course, do you have any additional advice for us as parents, community members? What can we do in order to be ready for our students to enter school?
All right, parents, you know, it's a very strange time that we're in right now, and there's just only so much that we can control. So I want my parents to know that we are pediatricians in the state, the health department, local officials, and the school officials. We are working together to do the very best we can to navigate this ever-changing situation. So y'all, additional guidances may come out, new research is coming out all the time. So some of this may change, you know. We are doing the best we can. We're going to take care of these kids. They thankfully are not at a huge risk from this virus, so we're just going to keep these kids as safe as we can, and we're going to try to have the best unusual year that we can have.
Right. Thank you so much. Of course, parents, we're going to continue to put FAQs out, videos out, information, and as Dr. Logan has said, as things change, especially as we get closer to August, we will continue to keep you updated. The plan is very fluid, and we will continue to keep not only what our medical advisors tell us, but of course our governor as well as the State Department of Health. So thank you again.
We will continue to release information to the public as it becomes available. On August 1st, we will release student informational videos that will help address some of the concerns of our students and how their schools will operate in the fall. We're excited to welcome all of our new students and our 75 new educators and staff members to Greyhound Nation. We are so glad that you have decided to make Ocean Springs School District your new home. Finally, some inaccurate information has been spread over social media regarding our protocols for returning to school. Please be advised that we will post our information on our Health Alerts portal, our Facebook page, which can be found by searching Ocean Springs School District, or it will be sent to you directly as an email from the OSSD Communications Department. Information from third-party sources may not always be accurate. For the most up-to-date information, check our Health Alerts portal on our website, follow us at OSSD Greyhounds on social media, and please be advised that we cannot consistently check common strands on our social media outlets to answer your questions. If you have read all of the information on our Health Alerts portal and you still have questions, please call or email your school. The OSSD response team can also be reached by emailing response@ossdms.org. I hope this video helps clear up some information regarding returning to school. More information will be coming soon. We thank you for your patience and understanding. Have a great Greyhound Day.